Hi, and welcome to the show. Rate and review at kevinmd.com/rate. Subscribe at kevinmd.com/podcast. Today, we welcome back on the show Francisco Torres. He's an interventional physiatrist, and his most recent KevinMD article is titled, Not Listening Carefully to a Vulnerable Patient Can Be a Matter of Life or Death. Francisco, welcome back to the show.
Thank you, Kevin, for having me again here.
Well, you've been on the show multiple times, and for those who aren't familiar with Francisco's story, just go to kevinmd.com/podcast, upper right-hand corner, search for Francisco's name, and listen to his story. Before we jump into this particular article, just tell us a little bit about your practice.
Well, I'm a physiatrist by nature, but I fellowship trained on interventional pain management. So my practice is outpatient doing pain management, including procedural and the fluoroscopic guidance. And I have my side business, which is the wellness, is my passion. I started doing that 20 years ago. And I spend at least 20-30% of my time with a wellness patient.
All right. And then when you say wellness, how is that incorporated into your practice?
Because there's a very good correlation between pain and overweight or obesity problems. So every patient that I see that have pain, that is almost they're overweight. So in their lack of exercise, and then they always blame it on the pain that they're not exercising. So there's a lot of education, and I spend time trying to avoid depending on the pain medications and trying to get them a little bit more active with physical therapy, exercise, and proper nutrition to block inflammation.
All right. So let's talk about one of your more recent stories. It's titled, Not Listening Carefully to a Vulnerable Patient Can Be a Matter of Life or Death. Now, tell us, how did this article come together?
Well, this is a story that I wanted to share, but it happened 20 years ago. And I was just I was just trying to run my business, trying to keep my practice afloat. And this patient, it's a matter of fact, it was a couple that I hadn't known them for several years, very, very close together. And then the wife came to me one day and to tell me that her husband passed away. And I remember that he had a lung cancer. So it was very painful for 6 months. So she just came to tell me that, and she left, and she had another appointment to see me for something not related, to that, to a musculoskeletal problem. And then later on, when she came, you could tell that she was still sad, devastated, and very briefly, she mentioned that she decided to join for a marathon in her husband's honor. And then I was busy, I have to say. She mentioned that to me, and my subconscious mind says, how can a woman in her 60s can suddenly find her passion for exercise and running? And even though she mentioned that, I just took care of her musculoskeletal problem and let her go. So I didn't spend the time to dig deeply into that, why she was running the marathon. And then eventually what happened was that I saw her later on, several months later, and she was rejuvenated, full of energy, thin. She was just fantastic. And then we were talking. I was so excited for her. And then all of a sudden she says, "Oh, Dr. Torres, can I share something with you?" And I said, "Of course." And she mentioned that the intention of running the marathon, because she was so depressed, was to kill herself. She thought that because she was not conditioned, that she could die running the marathon. Whoa, and that was like I missed all the signs and symptoms of depression. That's what really was my aha moment at that time. And that's the story, and I wanted to share because I think that now these days we're talking about that we don't have that time, the doctors don't have that time to spend with the patients because they have other business, electronic medical record, taking care of authorizations. And a lot of the clinics, including my clinic, they depend on ancillary services, other professionals to take care of the patient. And then the time with the patient, with the doctor is less and less. And I think there's going to be some consequences for that. And I try to bring that to the attention. And I think that what happened is that we try to be there mentally, but most of the time we're not. We listen to the symptoms, but we don't listen to what they're telling us between the lines there.
So after you heard that this particular patient ran that marathon to try to kill herself, tell me, when you first heard that, what went through your mind?
Well, I have to say, I don't know, because it happened 20 years ago. I think I felt scared. I think, wow, imagine the outcome, even though I'm not liable for that. But I think deep inside, I think I was responsible for that death. That's my fear. I would just have to deal with guilt for the rest of my life. So again, I saw that as a second opportunity to correct the way I interact with patients.
So tell me, what kind of changes did you make as a physician?
Well, the first thing was I need to take more time to listen and show empathy. I have to give the patient the opportunity to express their feelings and take the necessary steps in time, really, to recognize the signs and symptoms of depression, which is so common. And always remember that the nature of my work is easier at times if we are more involved with what the patient needs or is telling us. I think that I have to be aware that there's always a real cry for help if we dig deeply and ask the right questions. So I think those are the things that I learned. And then also my recommendation for everybody is to create more time with patient and minimize redundant and pointless tasks. To always remember that quality of care is related to time, or quality time, not just physical time, just quality time. And I think that it's time to bring back that essence of care where the physician-patient relationship in place is at the top of the model. So we have to listen to their stories. And also, I tend to do this. I tend to control the interview. I have to start slowing down and let the emotional agenda flourish. And again, open-ended question and try to pay attention to their feelings. That's basically what I learned from that.
Now, over your decades-long career, what kind of questions do you find that's most effective to ask patients to try to get them to open up or try to uncover something that may not be immediately obvious? Any questions that you find that was particularly effective?
Well, I think that is the way I enter the room. Most of the time, and I think this is a common thing we see with patients, they feel that I don't have the time, that they're in a rush. They say, I know that your time is valuable. I need to. And the first thing I do, I slow down. I say, hey, you're the only patient right now. I have all the time. Once I establish that, then the patient feels a little bit more open to relax. And then they are a little bit more open to start sharing some of the information that they need to share. And also what I do is I start asking an open question. Say, so how do you feel about this situation? Do you have any other issues at home that may be interfering with your recovery? So I try to bring a little bit of more of what's going on in the social part than just the symptom part.
So this particular story that you mentioned was an atypical presentation of depression. Any other things that you've garnered over your career that kind of surprised you to say, hey, this is depression? Any other symptoms that were similarly atypical like this one that you want to share with us?
Well, I think using this example is to all of a sudden they're doing something outrageous that they were not used to. So I think that just by saying, oh, good luck or good job, we have to say, why at your age? And now you're starting to exercise this much when you never consider that a priority. So I think like that will be one question that you can continue to follow. Or with other patients that they change something in their life, I want to know exactly how they feel and why they made that change. And when I do it on the wellness side, I always say, why you want to change? Why you want to lose the weight? And when you keep asking, all the time, oh, well, because I have a new boyfriend, I don't want him to leave me. Or I have a family review, or I feel so bad about my self-esteem. So now there we can open the conversation for more the psychological part of that question.
One of the things that you mentioned earlier was how important spending time with patients are. And you don't need me to tell you how valuable that time is. Now, a lot of physicians, their time is being taken away from them, right? From the electronic medical records, from administrators who want physicians to see more patients. Now, what could we do as individual clinicians to take that time back? Is there anything that we can do on an individual level?
I think, again, we need to strive to really listen. That's what I can tell you, because I can tell you by my training allow me to identify a medical condition within seconds. In certain cases, not all the time, but like, for example, a spinal compression fracture. I just talked to the patient what happened. I just can see it. Only took 2 minutes. I do the x-ray and confirm. But unfortunately, we're not trying to identify signs and symptoms of depression or social issues, because they don't have to be depressed. They can have a very serious social issue. If we don't ask, it's really interfering with the recovery. That's basically what I try to do. And I was talking to you before, Kevin, I think that we're talking all the time about burnout syndrome. I was saying that like it's unique of the doctor, but it's not unique of the doctor. Everybody has burnout syndrome. But the thing is, how do we handle that burnout syndrome? So I like to have a plan. So this case brought to my attention, yes, if I identify depression, what do I do? Do I call a hotline? Do I Baker Act the patient? See, it's not only that I identify depression, I see how I handle that. So I have to have like a plan. Either I have a hotline or a psychologist on board or a psychiatrist. So it's just not identifying the problem. It's just we have to know how to react to that problem.
Now, if you were to replay this whole scenario 20 years ago in your head, and she said that she was going to run a marathon, and then you did take the time to stop and ask her more questions because it was an uncharacteristic behavior, what would you have done next in your ideal situation? What would you have done next?
I think that I would have explored more into the feelings about trying to kill herself in terms of her purpose in life. And I think I would have told her that at least try to convince her not run the marathon to kill yourself, but to do it for cancer or for your husband. So try to redirect the purpose of that marathon and do it in a more positive way, not negative. So that will probably, and then I will have helped her, I think, to try to get in touch with a coach or a trainer and then talk about her way and be sure that she was going to be successful.
We're talking to Francisco Torres. He's an interventional pain physiatrist, and his KevinMD article is titled, Not Listening Carefully to a Vulnerable Patient Can Become a Matter of Life or Death. Francisco, what are some of your take-home messages that you want to leave with the KevinMD audience?
My number one is to pay attention and listen to the patient carefully. It's not, I don't think that we can evaluate or compare time spent with the patient. It's the quality of time. And I think that just you have to be focused. And I know that we all have issues at home, but at some point we just have to develop that tenacity to say, okay, when I'm with a patient in that room, that's the only person in my life right now. No distractions, basically.
Francisco, thank you again for coming back on the show, sharing your time, story, and insight.
Thank you, Kevin. Have a great week.